And now let's bring in NBC News medical contributor, Dr. Kavita Patel. She's a primary care physician and was a policy advisor for the Obama administration during the H1N1 flu crisis. Dr. Patel, good morning. Great to see you. Let's dive in here with this news. You just heard Dasha talking about the fact that vaccine distribution has hit a bottleneck, and now we have this information about the J&J vaccine that could get emergency use authorization, but we're learning that it's not as effective as the other two vaccines. So talk to people this morning. Why should they take the J&J vaccine if it's offered to them instead of waiting for Moderna or Pfizer?
Yeah, Kristen, good morning. And simply put, there is absolutely no reason to wait. You should take the vaccine that's offered. And I think that it's erroneous to compare 95, 96% to the efficacy from the Moderna and Pfizer trials with the J&J efficacy, which is overall, as you reported, 66%, but in severe cases, 85% reduction of risk of severe COVID, which is critically important because these trials, the Johnson & Johnson trials, took place at a time when we had at least one of the variants of concern, at least the UK variant, possibly others that were in the patients that were in this randomized trial. So it's a moving target. And at the end of the day, as Dr. Fauci has pointed out, as many of us have tried to say, getting to even 66% efficacy, we never thought would be possible, Kristen, within a year. So this is good news, a one-shot solution that does not require those freezers that Dasha was showing you is also critical because we can get this into the mass vaccination distribution points that most Americans are accustomed to, retail pharmacies as well as doctors' offices.
And Dr. Patel, so much talk about these COVID variants, some more infectious, some potentially more deadly right now. But how much more widespread? How widespread are these variants, especially that South Africa one? And how do they complicate our fight against the pandemic right now?
Yeah, Peter, great question. Simply put, we knew that as soon as we saw these variants in other countries, they were likely in the United States. We currently only do about less than 1% of our genetic samples conducted on the lab tests that check for COVID-19 coronavirus. So we are not performing the genomic surveillance that we should be, especially not on par with some of our other peer countries. So this is part of what we've seen in the Biden plan that I think will hopefully improve our overall genomic surveillance because, Peter, unfortunately, these are not the last variants, and we do need to put up a bit more of a wall of defense through better genetic surveillance.
Yeah, and we are now more than a year into this fight. People have fatigue about this, and those variants a reminder to stay vigilant. Dr. Kavita Patel, thank you so much for your time this morning.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.